Good evening, everyone. Good evening, everyone, and welcome to another wonderful session being sponsored by the Maryland Association for Parkinson's Support. I'm Howard Weiss, one of the local neurologists and a member of the Maryland Association for Parkinson's Support Physician Advisory Committee. Today, we have a wonderful and should be very educational, interesting session that will be delivered by two outstanding physical therapists who've devoted a lot of their career to taking care of persons with Parkinson's disease. And the topic will be physical therapy as part of your care team with Kristie Carpenter and Patty Wessels. They're going to talk about the LSVT Big program, Parkinson's wellness recovery, and group exercise programs. But before we get started, I want to remind everyone in the audience today that here's a question. What treatment is recommended for every person with Parkinson's disease? Exercise, of course. But I know for some of you who aren't used to exercising, this could be a change of routine. I just want to share a couple of my patients with you. So here's Mr. Franklin, nice gentleman, around 70, and he said throughout his life, he never really participated in exercise programs, and he really wasn't interested. And I told him how it could have such a wonderful benefit for his physical health, for his mental health, and he was very, very reluctant. I said, come on, sir, why don't you get into a class? So he came back at the next visit, and he said, Dr. Weiss, for an hour, I twisted, and I turned, and I bent and stretched, and I broke into a sweat. And I said, I'm so proud of you. But then he said, by the time I got into my leotard, the class was over. Oh, what are you going to do? And then this gentleman, he was an old crotchety fellow, never exercised, didn't eat a healthy diet. He still was smoking. I said, we've got to clean up your act. We want you to be well. I said, if you begin exercising, it's going to add years to your life. Well, he came back in the next visit and he said, Dr. Weiss, you're absolutely right. As soon as I started exercising, I immediately felt 10 years older. Well, these are exceptions. Exercise is an important part of the treatment for everyone with Parkinson's, but as you'll hear today, the programs have to be individually tailored to your own abilities and your own needs. And this means not only exercise, but often individualized physical therapy or sometimes occupational therapy. And there's a whole host of activities, including what we call aerobic exercises, where you could break into a sweat and increase your heart rate, and more sedentary exercises that can help your balance. But the key is there's a program that's right for everyone, but it isn't like one size fits all. And I think a lot of people have a misconception about physical therapy and exercise. It has to be individualized, and there's a program that'll be right for you. You know, because taking pills and medicines for Parkinson's is easy. You pop a pill and you forget about it. But participating in exercise, participating in physical therapy requires effort. And I always like to remind my medical students and the people that I teach that effort isn't always rewarded, but lack of effort is never rewarded. I really think if you put the effort into it, this could be a very important part of your treatment program. But as I said, everyone is different. And really to take care of people with Parkinson's disease and other illnesses, it requires a team, not just your neurologist or your medical doctor, but we're talking about physical therapy, occupational therapy, perhaps some cases speech therapy, social work, psychiatry. It's a team. And for each person, the team might be a little different. But with teamwork, I think people with Parkinson's can really lead a productive and active life. So with that, I'm going to turn my screen over to my colleagues, Kristie and Patty. So thank you for all attending, and I think you'll find this a very worthwhile program.
Thank you, Dr. Weiss. All right, so we're going to pull up our slideshow, and Kristie's going to lead it off.
Working on that right now. All right, thank you, Dr. Weiss. My name is Kristie Carpenter, and again, thank you to MAPS for allowing us to be with you today to talk about physical therapy as part of your care plan. So some of you may be wondering what physical therapy is. You may have never seen a physical therapist before in your life. Well, physical therapists, or PTs, are rehabilitation and movement experts. We specialize in prescribing exercise-based programs to help you improve your movement and function. We primarily work on gross movements, things like walking, transfers, and bed mobility. And we also specialize in treating orthopedic injuries, things like spine pain, shoulder dysfunction, hip or knee pain, and ankle instability. And as Dr. Weiss mentioned, and Patty and I will discuss further, daily vigorous exercise is crucial for individuals with Parkinson's disease to help manage your symptoms. If you have a shoulder injury, for example, that's bothering you and limiting your exercise, that can really impact your ability to manage your Parkinson's symptoms. So, exercise is medicine, and this is crucial. So I'm going to say it again to make sure everyone heard me loud and clear. Exercise is medicine. Individuals with Parkinson's disease have a variety of symptoms they have to manage. The motor symptoms that people outwardly see, such as a tremor, difficulty walking, stiffness or rigidity as we call it, slow movement or bradykinesia, those are just really the tip of the iceberg of what individuals have to manage on a daily basis. There are a whole host of non-motor symptoms, things like constipation, depression, mental decline, sleep trouble, that go into impacting your quality of life and your day-to-day function. Exercise can help slow disease progression and manage both these motor and non-motor symptoms.
And the way that exercise works to help people with Parkinson's improve comes down to two principles, which research is getting pretty robust in showing that this happens even in brains with Parkinson's. One is the concept of neuroplasticity. It's the capacity of the central nervous system to adapt itself in response to stimuli. Both internal and external stimulus, our brain can change from. It's the way that neurons, the little cells in the brain, actually change their structure and it can alter their function to help the individual cope with their environment. It's kind of thinking about like exercise we know for our muscles. Helps to improve our muscle strength and our power. But exercise also impacts our brain and helps the neurons to lay down better and deeper paths. The second principle is called neuroprotection. It's also stimulated by exercise, and it's the effect that results in the salvage, recovery, or regeneration of the nervous system, its cells, its structure, and its function. And if we take a look at this slide, the act of exercising with some vigor, getting the heart rate up, letting your blood pump, helps to release a host of chemicals in the brain. Some are called neurotrophic factors, and they help to, like miracle grow for the brain, help neurons to sprout new connections and to form new roads. There's also benefits that help to bring down inflammation in the brain tissue, decrease the stress of the brain tissue and the process of oxidation. It kind of helps waste products get out, good blood flow and nutrients to come in. There's evidence that dopamine neuron numbers actually improve with regular intense exercise. You get a better ability to balance out all the neurotransmitters, not just dopamine, but the acetylcholine and the other chemicals that actually help our body produce the movements when we want to. It stimulates cognitive function, and it really, really can improve your overall motor function, the way you move. Think about it like a bumpy, potholed road. And sadly, in Parkinson's disease, the road starts to get washed down for everyday things that we're used to be able to do automatically. Now we have to take more effort with. And the act of exercising with some intensity and with really great practice for the things like amplitude and the little details of the motion that helps it become efficient, the act of practicing in exercise can help you repave that road or go pave a new road off the side to help you keep being able to do the same skills without as much effort. Next slide.
There are two major exercise programs that were designed specifically for individuals with Parkinson's disease that utilize these principles of neuroplasticity and neuroprotection that have been well researched and show really good progress in helping people manage their Parkinson's symptoms. The first one is called LSVT Big, which I'll be discussing next. And then later on, Patty will be discussing PWR, Parkinson's Wellness Recovery. So LSVT Big was started by Dr. Becky Farley back in the late 80s. So it's been around for a long time, over 25 years. It's based off of a successful treatment for managing voice problems in people with Parkinson's disease called the Lee-Silverman Voice Treatment. That's where the LSVT acronym comes from. And the initial pilot data for this program started at the Lee-Silverman Institute for Parkinson's Disease in Scottsdale, Arizona. And then by the early 2000s had developed into a full intensive exercise protocol that started to be disseminated to people around both the US and globally. You actually can find certified LSVT Big providers throughout the world in over 80 countries, I believe it is now. So LSVT Big is an intensive exercise protocol. It consists of 16 one-hour individual therapy sessions that are provided 4 consecutive days a week for 4 weeks. It consists of daily carryover homework exercises, daily homework practice, and lifelong habit of practice. And all of this promotes brain change through neuroplasticity and neuroprotection. LSVT Big has a single treatment target, amplitude, or the size of your movements. So every movement that you'll complete in this program is big. Large steps, big reaches of your arms, exaggerated facial expression, use of a loud voice while you're counting, loud stomps of your feet, loud clapping of your hands throughout exercise. This increases the effort of the exercise and the intensity, which promotes production of neurotrophic factors like Patty mentioned before, and neuroprotective chemicals. By focusing on increased amplitude of your motor output, meaning the amount of effort you put into a movement you're trying to do, you begin to produce larger movements. As you produce larger movements, you start to become more self-aware of how much effort was required to produce that bigger, more normal-sized step, for example. As you become more self-aware, your internal cueing system starts to improve, and it's easier to habitually scale that increased amplitude of movement patterns, further driving this cycle until individuals reach a state that we refer to as calibration. Calibration basically means that you know and accept how much effort is required to consistently produce a larger movement, and you begin to start using that effort and getting larger output back with your daily living. So this all seems like a lot. What will a session of LSVT Big look like if I wanted to pursue this type of therapy? Well, each session, you'll complete 7 daily exercises consisting of sustained movements, things where you hold a movement for a long period of time, which helps with rigidity. And there will also be transitional movements like stepping. You'll select 5 everyday tasks with your therapist that help carry over the larger amplitude movements taught in the daily exercises to tasks from your daily life that are important to you. Examples might be sit to stand, getting up out of a chair, which we do several times a day. Even just getting up and down from a toilet is a sit to stand transfer. Other examples could be pulling something from your pocket or placing a bowl of water for your pet onto the floor. You'll walk big each session, and then you'll complete 2 hierarchy tasks that are, again, salient to you or important to you and meaningful to you, that consist of multiple steps and a lot of motor planning, things like getting in and out of bed or getting in and out of a car. You complete these items each session, 16 visits in a row. So there's a lot of consistency and practice, which drives neuroplasticity that we talked about earlier. And as you can see some images on the right of an instructor demonstrating a few LSVT Big exercises, they can be performed in multiple positions. Supine, laying on your back, is in the middle, seated in a chair, standing, or adapted standing where you're holding a chair or a counter for support. So regardless of your ability level, starting off, you can participate. It's never too early or too late to begin exercise. So to give you a better idea of what this program is like, we're going to take a few moments and I'm going to walk you through a seated exercise demonstration. And I would love for you to participate if you're cleared for exercise. If you're not sure if it's safe for you to exercise, go ahead and just observe. Otherwise, go ahead and position your chair so you have some space to move. I'm going to do the same, and we'll walk through 2 seated exercises together. I'm going to go ahead and move to a different part of my clinic and set up in a chair.
Don't forget to unmute, Kristie.
All right, can you hear me? Okay, so I'm going to take my seat. And I'd like everyone to do the same. First, let's get to the edge of your chair, and we're going to assume what we call our big posture. This will be our starting point for our exercise. Separate your feet so they're wide apart. Sit up tall as you can. I'm going to demonstrate the exercise first. And we'll do that with a big slap on our thigh. Let's give it a try. We're going to try 4 repetitions together. Out, out, down, up, back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Out, down, up, back. Nice and loud. 1, 2, 3, 4, 5. Keep stretching your fingers. 7, 8, 9, 10. 2. Out big, down big, try to get on the floor, up, back. 1, 2, 3, 4. Keep it up. 5, 6, 7, 8, 9, 10. 3. Out, down, up, back. 1, 2, 3, 4. Louder. 5, 6, 7, 8, 9, 10. 4. All right, right into our next exercise, because you want to try to keep the intensity up. You're going to start with your left arm and leg. Reach back, down, and across your body like a clock. Count to 10, and finish with a big slap on your thigh. We'll do 2 repetitions on the left and then 2 on the right. Here we go. Arm and leg back. Reach down and across the floor. Push through your back leg. 1, 2, 3, 4, 5, 6. Louder. 7, 8, 9, 10. Big stomp and clap. Again. Back. Down and across your body with a big reach. Push through your back leg, stretch those fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big stomp and flop. Okay, let's go to the right. Arm and leg back. Reach down and across your body. Keep reaching up. Stretch your fingers. 1, 2, 3, 4, you started sweating a little bit and felt some stretching in different parts of your body that maybe you haven't felt in a while. I'm going to get back to the presentation and transition it over to Patty. Give me one moment.
Next slide is up. So I'm going to roll right into it. Talking about power moves is kind of where we are next. And I think we skipped a slide. If we can go back one,
Yep.
Kristie.
Oh no, sorry, Patty, we have a problem.
That's okay. That's okay. I'm just going to start talking anyway. Believe it or not, PWR was developed by the exact same physical therapist whose initial work was the LSVT Big programming. Her name is Becky Farley. She was with the University of Arizona for a long time. And while LSVT Big was so well researched, as it went on for a decade or so, she wanted to start adding to the protocol, but it wasn't really allowed by the university system. So she started to develop her own thing, and PWR, Parkinson's Wellness Recovery, is that protocol. So same woman, same lovely picture. The mission for PWR is kind of similar to LSVT Big, with one little exception. The mission statement is to develop and implement worldwide access to cutting-edge Parkinson's disease-specific neuroplasticity principled exercise programming that holds the promise to slow the disease progression, improve symptoms, restore function, and increase longevity and quality of life. Where the LSVT Big program is really regimented, saying, once a week, or 1 hour, 4 days a week, consecutive days, 4 weeks in a row. Power ends up being a lot more fluid in the way that it's been developed and a lot more open access. In order to find information on power moves, you just have to go to YouTube or go to Google. There's this information out there that they want to make available to the entire world and make it very, very user-friendly. Go on one slide. So it's basically 20 moves, but really we can think of it like 4 moves that you have the option to do in any one of 5 positions. We can lay on our belly and exercise. We can lay on our back. We can work in hands and knees, which is frankly my favorite for these. We can work in sitting. We can do these in standing. And it's 4 moves in 5 positions. And they're kind of like the seeds of movement. So you're able to sort of pull and mix and match them to really mimic some of the functional movement patterns and everyday tasking. The other thing that I love about them is that how you practice can really vary based on how you're feeling that day. If you're having a very stiff and sore day, you can practice these slow and fluid and make them feel like stretches. If you're having a real sticky day, you can work in that big amplitude and try to tax for speed and try to open up all those brain chemicals and begin to move better in that day, exercising with the same moves with a slightly different focus. We're going to fast forward. Here they are. This is the power up. The power up is all about posture and getting really great alignment of your spine and limbs. If you take a look at the far left of your screen, she's on her belly propped up, making her upper spine extend. A really great way to counteract that stooped posture that leads to so much balance dysfunction. My favorite one for this happens to be on your back, and it looks like she's doing nothing, but this is really hard and great work. She's pushing her head into the ground. She's pushing her elbows into the ground. She's trying to lift her rib cage and shoulder blades up to the sky. It makes all of those muscles behind you work really hard against gravity to pick up some of your weight. In quadruped, that's that high kneeling, working at going from hands and knees up to a tall kneel in great alignment and posture, harder than it looks. In sitting, it looks very much like that first move in the LSVT Big. And in standing, it looks like a glorified squat where you're always coming back up to that biggest, tallest posture. Again, with that intensity through the hands, through the spine, open chest, all the same rules. We're going on now to, I believe, the power twist. Next slide. Oh, we got stuck. Yes, power twist. Rotation, the ability to twist and turn our spine, our shoulders, our hips, our ankles is really important for fluidity of movement. If you want to be able to move rhythmically or to help decrease your rigidity or improve transitional motions like rolling in bed or getting out of the car, twist is where it's at. So again, all of the positions, laying down on your back, on your belly, working from hands and knees, twisting in the chair, twisting from standing. There's a twist move for all of the positions. We're going to move to the next one, and that's going to be the rock. The power rock is all about weight shift. And if you happen to have one of the symptoms called freezing of gait, where your feet stick to the ground and you can't initiate a good first step, it comes down to this exercise for you. Being able to shift your weight from side to side, to offload your weight in one side of your body so that you can pick up the other side, is the effort of the power rock. It can help you to improve your ability to turn safely, again, rolling in bed. It even kind of comes into play with reaching tasks, right? If you're going to reach up high for something, you have to let your weight shift to that side you're reaching toward to get the length of your body you need for that high reach. And again, if freezing of gait is one of your issues, rocking is where it's at. The one on your belly, the first one in the gait, you can see it's almost like she's trying to crawl from her belly. The one laying on your back feels like a wonderful stretch if you're feeling a little sticky that day. The one from hands and knees is one of my favorite in the repertoire because you can push back from what looks like a child's pose all the way up into a plank or all the way down into a full push-up if you're wanting to work really hard in it. We're going to do a little bit in the sitting, getting that weight shift and reach, and in standing. Again, it kind of looks like you're reaching up for something atop the fridge with the standing rock. Finally, there's the step. It's all about locomotion with the step, right? We had to get your weight off of one side, and now you're going to take that other limb, be it the arm or the leg, and propel yourself somewhere. Laying on our belly, it looks like a commando crawl. Laying on your back, it kind of looks like something you might do scooting in bed, picking up your hips and letting them move, kind of a bridge with a single leg march. In quadruped, it's an amazing stretch for tight front of the hip muscles and bum muscles. It's also one of the first motions that you need if you want to get from the floor back up to standing, so very functional there. In the seat, which is one we're going to do today, it's kind of that first motion of getting out of a banquette at a restaurant, or maybe getting your foot out of the car. And then, of course, in standing, stepping not only forward, but being able to step at angles and sideways and backward with efficiency and with nice big amplitude. So, stepping is all about the transitions. This is some of the work that helps with balance, and it's all great for locomotion in bed, from a chair, or from standing. So we're going to take a couple of these for a spin. And I know that I'm not on the big screen, so I'm going to keep talking super loud so that I stay where you can see me. And again, all you need for this is a sturdy chair. We're going to choose to work today from the front half of our very sturdy chair, if you're cleared to participate. Just like before, we're starting in the big posture up. Same business here. Notice your feet. Make sure that they're planted into the floor. Notice your knees. Make sure they're on top of your ankles. Stretch up your spine nice and big. For this first one, the power rock, we are going to reach our right leg out and we're going to lean over onto our left thigh. I'm going to stretch my free arm all the way up. I'm going to bring my eyes up and I'm going to look at my hand and appreciate that my fingers are spread out as far as they can be spread. We're going to pull back up through center, leg comes down, hand goes right back on the leg. Then we're going to take it to the other side. Leg slides out, elbow on, nice big reach, look up. If you're feeling a stretch with this from armpit through waist down into your hip, you're exactly right. And then come right back up. Notice when you do it again to the other side, that the arm and up, that's up, and the leg that's out, there's almost no weight left in that butt cheek. All the weight is now down on the side you're leaning into. Check it on the other side. Rock your weight over so that you can stretch the leg far away from the hand. Where this becomes important is in movements of transition sometimes. You know how sometimes you'll get stuck in the chair and you want to scoot back, or you're too far back and you want to scoot forward? It's that motion of rocking that can help you to sort of scoot your tush forward or to scoot your tush back. We just happen to exaggerate it in the practice as we're going. The power step is the other one I wanted to share with you. From sitting, it starts in very much the same way. Tall spine, wide feet. We're going to have our hands on top of our bottom of our thighs, close to the kneecaps, if you will. And we're going to use some momentum with this. I'm going to lean over onto my hands. And I'm going to push myself back with just a little bit of effort, but I'm going to imagine that my right hand is glued to my right knee so that when I push back, I almost help lift up that knee. Try that first before we step around. Lean forward, lean back, bring up that knee into your hand, lean right back forward. Try it on the left leg, and then we'll take it around the chair. Press up and down. You're using that big action of the trunk moving forward and back to help with the effort of picking up the leg. We're going to take it to the right. We're going to lean in, lean back, pick up the right leg. This time, open it across the corner of the chair. Good. Let's bring that right leg back. Lean in. You might feel a little stretch on the inner thighs. That's not bad. Pull that leg back around, land it in center. Try it to the left. Lean in. As you lean back, pick up that leg, swing it around, plant it firm. Lean in. Feel that little stretch? Good. Lean back, pull it in, and set. It's kind of like the action of getting out of the car, right? We've got to get that leg around. We just increase the effort through the trunk to try to make that action a little easier and to unlock a little bit of that mobility. You can imagine that if we did these with a little bit of speed, heart rate would get up, right? We're using big muscle groups, aren't we? So let's take it 4 times with a little bit of a tempo. Right leg center, left leg center. Ready? Tall and go. In, open, in, return. Other side. In and open, in, return. 2 more. In, open, in, return. Last time. In and open, in and return. When we go quick, we don't really feel the stretch with it so much anymore, right? So appreciate just one more time with me that if we were having a very sticky day, we might choose not to do it fast, but to go slow and let there be stretch. So if we lean in and just take out one of the legs and hold, and then lean in and hold here, elongating the spine, opening the knees, we're doing a nice bit of stretching for the inner thighs, for the hips, for the spine, and that's all good stuff. Let's bring that leg back with some vigor. Lean in, lean around, pull it in. So again, power moves are like the seeds of movement in the way that I think of them. And if you came into my clinic and we decided that this was one of the repertoires we would go with, and you talked about how you're getting stuck in the car or getting stuck in, trying to maneuver when you guys were at a restaurant and you were on the bench, and even though you were at the edge, you felt like it took too long for you to, get out of that situation. We can use some of these to help mimic those actual motions and make it part of your exercise repertoire. I think these all feel pretty good. All right. I think we have one more slide for me. And this is kind of what I was speaking to. If we're going to try to change our brains and lay down and repave these new neural networks and roads in our brain, then how we use our exercise is kind of important. I think everybody needs cardiovascular exercise. That's how we get the brain chemicals primed up so that those neurons can sprout and we can relearn some movement tasks that have been getting hard. We can up our amplitude and get calibrated, like Kristie was saying, to what more normal motion feels like. But we got to have those brain chemicals present to really make the best effort of it. But after those brain chemicals are present, maybe you need to focus on your rigidity. So you go slow and rhythmically, and things look more like stretching or than they do, hardcore, intense exercise. Maybe if slowness is your biggest problem and small actions and getting stuck is your biggest problem, we focus on the going big and on the going fast. And we really try to keep all of our exercise high effort, focusing on that amplitude to help you get the best that you need from the exercise. Some people with Parkinson's struggle with some incoordination. And that's where something like a power flow goes well. One of the things I love about these is you can string them together and almost make like a vinyasa flow yoga class out of it. I think that's particularly powerful for the work that we do on the floor in hands and knees, on your back and on your belly. You can string them together and really get a lot of motion and really smooth out some of those bed transitions. There are things that we can do, adding finger flicks, adding looking, adding counting to get more work in the brain and more in the fine motor, if grasping and fine motor is one of the places you're very impacted. And then finally, if we're talking about reduced self-awareness, not really knowing where you are in space, we use a lot of external cues in PT to add extra effort. Sometimes we're cueing the breath, or again, the gaze or the finger flicks as a way to help you find more parts of your body and integrate them into these big movement patterns. All right, next slide. So I kind of said this, what you do for exercise matters. You need some cardio to neuroprime. We want to drive neuroprotection and neuroplasticity, which means we want really great practice, really regular great practice. The Power Moves program, and I'll say LSVT Big too, can all help you get better at your agility, your transfers, your turning, the way you walk, impact and build your overall strength. There's things about them that lend to more flexibility. We can make it really specific and target your deficits and try to make your activities of daily living a little bit easier so that we're helping you improve your function. That leads to a better quality of life. We're always working on balance, even in our folks who aren't standing as much as they used to and aren't walking as much as they used to. Even in sitting, we need really great balance. We can play with reach and grasp, although we'll talk about OT in a minute, and that's kind of their deal a little bit more than us. We want to help you be able to get good aerobic activity to drive these brain chemicals. And we want you to enjoy what you're doing. Lifestyle matters and living your best life matters. And exercise really can be a part of that. All right, I said it was open access and I meant it. There's a book that you can get for $29.95. It has all the moves, it has flows already built in, it has some of the science, it's user-friendly, it's not meant for clinicians, it's meant for everybody. And I will tell you it's only $25.95 if you go to the website. And I think the bottom of this got cut off. There we go. It's powerforlife.org. That's the Power Moves website. There's a ton of videos on YouTube. You want to search Parkinson, not S, Parkinson Wellness Recovery. Warning, if you type PWR, you're going to get some stuff you might not want. So type out the whole thing, Parkinson Wellness Recovery, and there's literally like 100 videos when I looked. One note about the book, they do have it on Amazon in the Kindle version. don't get the Kindle version. The actual book is spiral bound, so it can open up flat and be right on the floor ahead of you, or right out ahead of you opened and stay on its page. And it's really, really user friendly. The Kindle version doesn't seem as user friendly to me. And don't buy it on Amazon. Amazon is selling it for way more than $25.95. When I looked last weekend, there was a used one for $1,000. Don't do that. Yeah.
All right, so as Dr. Weiss mentioned and Patty just alluded to, there are a few other members of the rehab team that you may need at some point in your care. Those would be occupational therapy and speech therapy. So occupational therapists focus on fine motor skills, acts of daily living, things like bathing, dressing, feeding, grooming, and instrumental acts of daily living. Things that you need to do to help manage yourself and your household, meal prep, laundry, medication management, finance management. And occupational therapists can also be certified in LSVT Big and Power as well. So you can potentially see both a PT and an OT that will be familiar with these programs and utilize the concepts along with skills that are more specific to their field of study. And then there's speech therapy. So speech therapy helps with the volume and the clarity of voice. They help with cognition and memory, and they help with swallowing. This is very important. Any caregivers on the call, please take note. If you hear your loved one having a lot of coughing with eating and drinking, or drinks constantly going down the wrong way, that could be a sign of starting to have a problem with swallowing, which is a big safety hazard. Please let your physician know about this and ask for an appropriate referral to speech therapy. And then there, of course, is LSVT Loud, which is the LSVT Big equivalent program focused on speech volume and clarity. And as we've said before, exercise is medicine. Exercise is miracle grow for the brain, as Patty has said before, which is a great analogy. Our brain is capable of changing throughout our lives. It's capable of forming new pathways and overcoming some of the damaged areas that happen from this disease process. So don't give up. You can do more to help manage your symptoms and slow your disease progression. You can maintain and even increase your quality of life with the right care team. So if you're interested in either of these programs that we talked about today and think they might be for you, you can look for a certified therapist at the websites listed below. And you can search by your zip code to find someone that's convenient to where you live. Here is my information and Patty's information if you have any questions that you want to reach out to us directly about. And then you'll also see again that you can check the MAPS website. They offer more talks like this, as well as caregiver support, information, and a variety of both Zoom and in-person classes in various areas in Maryland. So there are a lot of ways that you can also get involved in community exercise too. And I think that's it for us.
Well, that was wonderful. That was really wonderful. And I'd like to expand just on one thing that Kristie just said, is that for those of you who have Parkinson's, I think it's important to see a therapist who has a special interest in Parkinson's, who's trained in these two disciplines, either the LSVT or the PWR. Even just like there are doctors who specialize in orthopedics and doctors who specialize in dermatology, there are physical therapists who might have special interest, let's say, in spine problems or neck problems or hand problems, and they may not necessarily have that interest or expertise in Parkinson's. So fortunately, we live in Maryland where there are plenty of people who are certified in these techniques. So I think that is going to be important. Well, we have a bunch of questions that have been submitted actually prior to the talk. Here's an important one. I thought I would ask this first. couple people asked about health insurance and Medicare covering these programs, and then is there a limit to how many visits a year, for example, Medicare would cover for physical therapy or occupational therapy? So,
Yeah, I can take that to start. So the way Medicare does cover this type of therapy, so each individual has a Medicare cap for the year. The dollar amount changes slightly each year, but Medicare covers about $3,000 approximately this year for Medicare for the entire year. At that point, if you used up your cap, they do continue to cover care if it's deemed medically necessary. Like say you have a flare up in symptoms, or you try to manage on your own with home exercise program and community exercise class, but things are just getting a little off track. You can go back to PT or OT or speech, even if you've used up your cap, is because it's deemed medically necessary to help you maintain your function. And at the same time, if you happen to have an injury not related to your Parkinson's disease, like you had a hip replacement, you can still be treated for that, even if you already had treatment for your Parkinson's, because it's medically necessary to make sure you recover appropriately from that surgery. And then speech therapy falls into the same Medicare cap as physical therapy, unfortunately, but the same reasoning around medically necessary applies. So if say you used up your whole cap on speech, but you've never seen PT and you really need to work on your walking, that would still be deemed medically appropriate. And our documentation that gets sent to Medicare and your secondary insurance coverage would show that. And then speech therapy has its own cap for coverage. Hopefully occupational therapy has their own cap for coverage.
So for example, would a course of the LSVT be covered by the $3,000 cap?
Yes.
Okay, well, that's important. That's good. So another person wanted to know, how do I know when I need physical therapy versus just participating in a group exercise program? So individual.
I'll take that.
Group, yeah.
Yeah, since I also lead group exercise, I'll take that. One thing might be, you might not notice that you are having more difficulty moving. Very often it's the care partner, the spouse, the kid who kind of starts to have to tell you more, sit up, do this, do that, step big, watch out. And when the care partner starts to see things that begin to look less safe or less normal than they used to, that's probably a good indication that it's time to check in with your physical therapist. For a lot of the folks that I see intermittently with Parkinson's, I have a little battery of tests that I do with them. And so, I'll run these tests that look at their balance, their dynamic gait, how far they can walk in 6 minutes. And I have notes on these going back. So I send them home. They've gotten their exercise routine. I normally like people to check in with me every 3 to 6 months. We just kind of set an appointment out so that in 3 to 6 months, you come back and we just double check, have those scores changed a little bit, a lot? Have you gotten better? Have you gotten worse? And then make a determination if we're going to restart care and tune you up or send you back out in the world, back to your community fitness classes. So that's one way that it kind of happens. But if your, care partner has been nagging you more about your posture or nagging you more about the way you're walking, that's probably another good sign too, that it's time to check in.
I do the same thing as Patty. I recommend my patients come back in either a 3 to 6 month interval, usually depending on the severity of their symptoms. People that are higher functioning, I'll usually say come back in 6 months or sooner if something does change. And then people that might have a few more symptoms, I'll check back in with more frequently.
Here's a question. What about going for long walks using a stationary bicycle at home or a treadmill? Are these things that you would recommend? Are these things people should be doing on a regular basis?
Yeah, I'm going to say any exercise you like to do and that you're going to do regularly is all for you. So the treadmill is a really great place. And even if you feel like you're walking slow, I might just kind of ask you to start appreciating the effort you're giving that walk and start noticing, say on like a 0 to 10 scale, where 0 is I'm not working hard at all. I'm sitting on the couch resting. 10 is I'm working so hard. I couldn't possibly do this for another 10 seconds and I can hardly breathe. You want to think about your work being somewhere in that middle 4 to 7 range. We want that 4 out of 10 intensity every day of the week. Every day you exercise, you want to be getting at least that 4 out of 10 effort to drive some of these brain chemicals. But you could get a lot more out of those brain chemicals if you can push it to the 7, even if that's for 30 seconds at a time or for a minute at a time. One of the exercise repertoires that I often use, not only in the boxing class I teach, but when I'm setting patients up for independent exercise, is a high intensity interval repertoire where you go all out for a short duration, say 30 seconds, but then you give yourself 10 seconds to take a deep breath. You keep moving in that 10 seconds, but you're not moving hard or fast. On the treadmill, that can look kind of similar to walking fast for a minute, walking normal for a minute, walking fast for 2 minutes, walking normal for 2 minutes. And that's a great way. The bike is a wonderful place because it's real easy to sprint out for 30 seconds, bounce your heart rate up, and then settle to a steady state and catch your breath again. So it can be.
Yeah, I'd like to add something to that. I'm not a huge fan on the treadmill just because there can be some major safety risks involved with the treadmill. If freezing is a major symptom for you, it can be very easy to have a freezing moment and slip off the back of the treadmill, leading to a fall that could have serious injuries. So I would be a little wary of the treadmill. And that kind of goes along with knowing your symptoms or maybe having a more expert evaluation before you decide to make that your exercise. I also like the rowing machine for individuals if you're thinking of a piece of gym equipment for cardio, because you're moving both your arms and your legs in a repetitive motion. So both upper body and lower body.
Good advice. Several patients submitted questions basically saying, gee, I have chronic low back pain unrelated to my Parkinson's. So what can I do? Because so many of these things would seem to aggravate my back pain. So how do you handle persons who have chronic back problems, which is such a common issue?
Mm-hmm. Yeah. So I will say that we just have to deal with it. We have to figure out what you can do well that isn't first going to irritate your spine. Better than that, though, what can we do well that helps your symptoms and builds your core strength, builds the muscles of your posterior chain, your back, your butt muscles, the muscles that lift and propel you, your core and your hip muscles that stabilize you. Working on our back or working in hands and knees is a really phenomenal place to start treating people with chronic neck, back pain. It's just a really great place. It's where we would work if you were just in the clinic having spine pain because of either disc or stenosis. Those are the positions we would start to exercise you in anyway. We just happen to have some power moves that are in those positions that we can kind of weave into a personalized program to address those orthopedic complaints.
Absolutely. Yeah, all fours position, quadruped is great for people with spine pain because your spine is unweighted. There's no compressive load in your spine like there is when you're sitting or standing. So that helps alleviate symptoms for a lot of people. And people will also often find that rigidity and stiffness, that actually contributes a lot to your back pain. So it might seem intimidating to start some of these moves where you're doing large amplitude movements, twisting and reaching, but that's actually kind of what you need to actually help with your spine pain. Twisting, I like to call it in our clinic, the lubrication for your spine, the WD-40 for your spine. Our spine moves in 4 directions, almost 3-dimensional, almost 4 dimensions, but most of our everyday activities are one plane of movement, flexion, extension. So rotation really unlocks the spine and actually helps a lot of spine issues.
How do you ladies feel about recumbent exercise bicycles?
Love it.
I think they're great. Yeah. Yeah, whatever is comfortable for you, whatever you can commit to and be comfortable doing is going to be the best right answer to start with.
So now here's the question. One of our patients unfortunately has occasional falls. Are there ways you can teach people to fall more safely?
Yes.
Obviously, the best treatment is prevention, but unfortunately falls do happen. Is there something that you folks can teach people to make the likelihood of an injury diminish?
Yes, I'm going to say it's always scary. It is always scary when we get out the big blue mats and start to practice it. It's scary for the patient, it's scary for the therapist, but you know what? It's an important thing. And even if it's something that we only go through a few times, how to tuck and roll, how if it's a backward fall to get your head in and get ready to brace with elbows, it can be a really important thing just to do a few times. And hopefully when that fall comes, something will kick in and you'll remember that your job is just to tuck and try to roll. I will say also in Rocksteady boxing, that is something that we would do with some regularity. Every few months, we would get out the big blue mats and the focus of that day would be to practice our falling.
And obviously there are also exercises that would help people who do fall to get up by themselves. They don't have to call 911.
I think that's huge. And I know, Kristie, you totally agree. Working in hands and knees and getting our people on the floor means that I'm not getting them on the floor. I might be helping a teeny bit cue them how to get up and down safely. But what I love most about getting folks on the floor to exercise is they got to get themselves back up. And that right there is an amazing functional exercise. And, you know, nothing's more scary than knowing you're down and you and your spouse realizing that the two of you can't figure a way up. That's just terrible. And it makes making that fear of falling even more present after the fact. If you had to have 911 come and the lovely folks at the fire department come and pick you up, you know, it makes that fear of falling really, really rise up.
And here's another question. How do you decide when someone would benefit from using a cane or a walker? And are there special canes or walkers that seem to be more helpful for Parkinson's disease than not?
That's always a tough day. So that's always a tough conversation. Even with people who know it's coming, nobody wants to hear that somebody else, you know, is thinking that it is really time for either a rollator. A lot of times I'm not recommending canes too much. What about you, Kristie? Are you recommending canes a lot?
I don't use canes a lot. I find them difficult for people to sequence appropriately, and trying the cognitive load of trying to think about how to sequence that cane plus your footwork a lot, and makes people more unbalanced than either walking without something or using a rollator or walker.
Yeah, I tend to agree. And if we are going to do something, frankly, that is earlier on, then maybe they're not ready for a rollator. They're not ready for a U-step, which is the specialized walker with the reverse braking system that is manufactured for people with Parkinson's. It's a great piece of equipment. It's super sturdy. It has the laser or the metronome if you need the cueing for freezing of gait. It's a great piece of equipment. But we normally start with something more like a rollator. Even better is to start earlier than that. I love Nordic poles, the hiking poles. There's a particular brand that I'm really enchanted with this year called the Activator. And the reason I love it so much is that it has this really great ledge so that on the handles of the pole, you can push down to really generate great lift of your posture. And the way that you push down to those poles gets an even better activation of core muscles, just as you're normally walking. It drives that big arm swing if you get to using them. They're a little bit sporty, so you can take them out on a trail or out in the neighborhood, and it's not like you're walking with a cane. You know, you're Nordic walking, you're walking with poles. And I'm really a big fan of those for earlier balance difficulty, or for people who have just noticed that they can't walk on level surfaces. Their family used to go on hikes together. Now they're staying behind because they don't trust the terrain. That's a really great solution and really good exercise.
No,
Yeah.
I think
Tools
it's
all the
really
time.
underutilized. I think that's an excellent suggestion. So I think we have time for one last question. And does exercise play a role in helping people with anxiety or depression? What effects does exercise programs have on mental health?
Yeah. So I will tell you that there is actual clinical research with people with Parkinson's looking at some of the quality of life indicators. And one was a depression and anxiety scale. And people who engaged in regular exercise over the course of, I want to say that study was just 3 months long. I think they did it together for a month and then they did a look back at the third month. And there were clinically significant improvements in depression, in the index that they were using, and in anxiety. You know, this is where salience matters. We're telling you exercise is important. We're telling you that you need to start somewhere, and hopefully you can find something you enjoy, because exercise can bring joy. And when you get your heart rate up and you get those good those good brain chemicals happening in your nervous system, some of those are feel-good chemicals, right? Serotonin. You've heard of the runner's high and the endorphins that athletes can get. You're going to try to unlock those yourself a little bit. And maybe this is where community exercise or a class with other people with or without Parkinson's is a good thing. You know, maybe you bring joy into your life through your exercise because it's something like boxing where you're hitting a bag and taking out frustration. Or maybe it's something like dance and you're enjoying the music and the people and moving your body. So yes, I think exercise definitely has been shown clinically and just anecdotally. If you can find something you like to do and do it, it should be able to help you better manage some of those anxious or depressed feelings that you have to kind of learn how to manage yourself.
Kristie, anything you want to add to that?
I think Patty pretty well covered it. Absolutely. Exercise can release endorphins and improve mood and help level out some of those various neurotransmitters in your brain, as we talked about in some of the earlier slides. So absolutely, exercise can help manage some of those feelings. And then camaraderie sometimes from group exercise can be really good for individuals. And like Patty said, it doesn't necessarily have to be group exercise with other individuals that have Parkinson's. It can be just with friends or a neighbor or family. I know some people sometimes are a little hesitant to join a Parkinson's specific group class because they're afraid of maybe seeing what other symptoms people have that maybe they don't have yet, and they find that scary. You know, wherever you're comfortable is the appropriate place to be. Whatever gets you moving is the best kind of exercise.
I think one can't underestimate the psychological benefits of exercising, particularly in a class, because the socialization is often very beneficial, and the camaraderie that develops, particularly many of my patients have said that in their boxing classes, et cetera. Just the camaraderie of the class is very good for their mental health. Well, I really want to thank Patty and Kristie. Wonderful session today. I think it was very informative. I want to remind all the attendees that there will be evaluation forms distributed at the end of the session. We'd like to get some feedback on whether you feel these sessions are valuable. And I want to remind everyone who attends today's session that, of course, the Maryland Association for Parkinson's Support sponsors some phenomenal programs, exercise classes, boxing, dancing, singing, et cetera. So please look at the Maryland Association for Parkinson's Support website. And for those of you who have the abilities to make a contribution, whether large or small, even if it's just a small contribution, hundreds of small contributions make a big difference. And I think the Maryland, I want to tip my hat to the people who do their work for the Maryland Association for Parkinson's Support. You're really a great asset to our community. So with that, everyone stay well. I'm hoping COVID will be gone shortly and we'll have some live programs and we'll be able to have these meetings perhaps in person in the near future. So best of luck, and thank you once again to Kristie and Patty.
No, thank you.